Hello, my name is Samuel Rodriguez, and I'm going to be interviewing my dad, Johnny Rodriguez. He is a firefighter paramedic, and he's gonna tell me about the human respiratory system. So, question one: how do you know if someone has a respiratory issue?
The number one way we figure out if somebody is having a respiratory emergency is how they talk to us when we first get on scene.
Mm-hmm.
How they look when we first arrive on scene, and what their interactions with us are.
Mm-hmm.
If it's an early emergency, they're going to be breathing like they just ran a mile, but they haven't been working out. So their body is going to be breathing heavy, breathing fast, trying to get that oxygen into their bloodstream. If I see that on somebody that hasn't been working out, that tells me that we have somebody that's having a hard time breathing.
Question two: what does a respiratory failure look like?
Respiratory failure means the respiratory system is no longer able to maintain the oxygen demand for the body. Meaning that that person is actually going to start declining to the point where they are no longer able to breathe for themselves. A normal person breathes between 12 to 20 breaths a minute. Somebody in respiratory failure is going to breathe a lot less than that. 8 breaths a minute, 6 breaths a minute, less than that. So when they start breathing less and less, changes are going to happen to their body. They may not be able to communicate with you anymore. They may not be able to stay awake. Those are the things that we look for, and then we interact and start treating that respiratory failure.
Question three: if respiratory system fails, how does that affect other systems in the body?
The respiratory system is part of the entire human body, as well as most every living mammal on the planet. If the person stops breathing, oxygen will not be able to be brought into the bloodstream to feed the rest of that body, and that'll cause systemic failure on multiple levels. It can start the heart to beat irregular. Now that you have a irregular heartbeat, the amount of blood that's circulating through the system isn't going to be sufficient to keep the levels of acid out of the cells, making muscle cramps, producing excess acids in your system. Your body expels those acids when they breathe out. So respiratory failure would then make it so your body becomes extremely acidic, becomes extremely acidized, and you're not able to get rid of that by breathing out. So it's two folds, does not give you the oxygen you need, and does not get rid of the acids that you cannot live with. And that can change your brain in making you unconscious. That can change your heart in changing your heart rhythms, the way that you beat. That'll change your muscles in not able to function properly. Your digestive tract in not getting the nutrients out of the digestive tract to feed your body. So it causes a huge systemic issue. Not just because the respiratory tract failed, but because it's one part of the whole system, and it's going to cause problems.
Question 4. Do you give any medicine or treatments?
We do give medicine. We give a medicine called albuterol, and that basically opens up the tubes in your lungs to allow more air to go in. We give another different type of medication called epinephrine, and that creates an increase in breathing and allows the circulatory system to move that oxygen-rich blood through the system to help for allergic reactions. The last treatment that we do is manual manipulation of your breath. We force air into your lungs because you're not breathing right. So we have a bag valve mask that we will place onto your face, and we breathe for you. We become your body's draw to breathe. We force air into your body to make sure your blood is getting the oxygen that it needs, because your heart is still working, but your lungs and your reason to breathe is not working. So we force oxygen into your lungs for it to be pumped by your heart to get you working.
Question 5. Tell me about being a paramedic during COVID-19. How do you protect yourself? Do you see a lot of COVID-19 patients?
There are a lot of COVID-19 patients that I see. I protect myself and my crew. We protect ourselves by wearing the proper personal protective equipment needed. We wear masks, we wear gloves, we wear gowns, and often we wear face shields. That helps protect us from any type of airborne or particulate matter that's in the air on patients that we go to. There are some patients that are having a difficult time breathing. We assume those people are COVID positive. There are other patients that fell and have an injury to the parts of their body. We don't necessarily assume that those patients are COVID positive, but we practice like they are, just in case they're asymptomatic and potentially are able to give us the virus. So we go onto every call as if they are COVID positive, even though we don't have confirmation that they truly are. We treat everyone equal. We treat everyone as if they have COVID. And we tell our patients that we are protecting us from you just as we want to protect you from us. Because my last patient may have been COVID positive and now I'm here in your home to provide you help. I don't want to make you sick. So I'm here to help try to make you give you the help that you need, but I don't want to infect you with any virus that I may have received from my last call. So we work really hard to try to protect us as well as protect our next patient that we try to help. We want to protect both.
Is that it?
Do you have any other questions?
I don't think so.
Did your teacher have one other question?
Oh yeah. What is the most broken bone? Or like what a bone gets broken the most?
Now, based on you talking about respiratory system, I was thinking your teacher is referring to like a broken nasal bone, like breaking your septum, breaking your bone of your. But I honestly can say the most common broken bone that I've gone on for not only kids but as adults is the clavicle, the shoulder bone. People fall and put their arm out, and boom, they break their clavicle, their shoulder bone. That's, to me, the most common broken bone. I can't tell you how many times we've gone on those types of patients that have had that injury. And it's a quick repair, it's a quick fix. You have your arm in a sling, you wear it for a couple weeks, the bone grows back together, and okay, then you move on. But yeah, that to me is the most common bone fracture is the collarbone, the clavicle. And that's it.
So that's it. So bye-bye.